It really depends on the child and what they have been taught.
Yes.
Some children come in, they don't experience any anxieties. And some other children will come in and they might be a little bit nervous.
Ladies and gentlemen, thank you for joining me. I have a very special guest here. Her name is Dr. Loretta Smith. She's going to tell us a little bit about herself. And we're going to be talking about children who are nervous about going to the dentist. And this is all in honor of February, which is National Children's Dental Health Month.
Okay, well, I want to say thank you for having me on with you today. Okay. Linda, I am a pediatric dentist. I practice in the city of Chicago. Mm-hmm. And I have been a dentist since 1985, but I became a pediatric dentist in 1990. So I've been a pediatric dentist over 25 years.
25 years of kids. I'm just going to guess. That's about 5,000 or 10,000 kids. I don't know. A lot of kids. You can't even count, can you, of how many kids that have been in that dentist chair? Hundreds.
Yes.
Yes. So I would say you have a lot of experience with kids who are maybe coming to the dentist for the first time. And what age would you say that a child goes to the dentist for the first time?
The American Academy of Pediatric Dentistry would like our children to be in a dental home by 6 months. And definitely 6 months from when the first tooth erupt. So anywhere between that 6 months and 12 months, they should see a dentist.
Wait a minute. You mean a 6-month-old baby? You mean a 6-month-old?
Yes.
I didn't know that.
Yes.
Young. Really?
As soon as I can see the child, I can start giving some very important information in terms of prevention. Okay. What they should be drinking, how the mother should be brushing that child's teeth, any habits that a child has. It's really important. It's a very important time to start. Because the sooner I start, okay, the better for that child dental health.
Now, what do you find is the emotion that children are having when they're first coming to the dentist? What are you seeing?
Yeah, if I see them early at 6 months, well, they're going to usually be sitting with their mother. So anybody at that age, they have an attachment to the mother. So that separation anxiety, they are going to stay with the mother at that time. But when they become older, maybe around 2 or 3, it really depends on the child and what they have been taught.
Yes.
Some children come in, they don't experience any anxieties. And some other children will come in and they might be a little bit nervous. But it really depends on what has been said at home. And then if they have been to another dental office and what they have experienced at that previous dentist.
What are some of the do's and don'ts to tell kids at home, the parents? What should you not tell your kid about going to the dentist so that they don't have anxiety?
Well, first thing you shouldn't be starting. And a lot of people like to do this. Oh, you're going to go to that dentist and they're going to give you that needle. That's the first thing that people say. Then, when they come to the office, they're going to be nervous.
Yeah. So don't tell them that. Number one, don't tell them they're going to get the needle.
Yes. And then don't tell them that they're going to be doing something to hurt you. Don't use any of that terminology with them.
So how would you coach parents? Their child's getting ready. Let's say it's a 2-year-old, 3-year-old about to come to the dentist. How would you coach the parents? You've already said things not to say. What should they say?
Okay, well, one of the things that what we do in the office is, number one, I try to talk with the parent about their previous dental experiences and to see where the parent is. And where their experience negative or positive when they were having dental treatment. That plays a very important role in terms of us trying to do dental treatment. Mm-hmm. So we talk about that. Then we give them a handout on some of the things that what we're going to be doing and what they should say. Some words what they should say and words they should not say. Like if we're going to be using a handpiece, we call it a Mr. Whistle. We had to put a rubber dam clamp on. We're going to put a ring and a raincoat on your tooth. We have a complete sheet that we tell them what the different procedures are that we're doing.
Okay.
So that child could less anxieties.
Yeah, and you're using words that they can relate to, raincoat or whatever.
Yeah.
Yeah, oh, that's good. Now I want to go back to something you said. You're talking to the parents about their previous experiences. And I guess that's so they won't transfer that anxiety if they had a negative experience. You want to know that, and you want to coach them so they won't transfer that anxiety onto the child.
Yes.
So you of course you want the child to come in and they're excited. They're going to get their teeth cleaned for the first time. Although you do that younger, but this may be a new patient for you. You're going to clean their teeth. But when they get in this room, and like that picture of the child I showed you, and they're looking up at that lamp, and maybe their mom's not in there with them, what are you going to do if they start crying?
Well, what we're going to do is we're going to talk with them. First of all, we talk with the child. If it's a new patient, we have like information about their school, what they like, they dislikes, what food they like. So we are going to basically relate to that child and talk with them. Mm-hmm. And then as we talk with them, we're going to explain to them everything that what we're going to take. What we're going to do. Like if it's a new patient that's coming in and they're coming in, they haven't been to the dentist before, they haven't seen any of the equipment or anything in the room, like the other chair. So then we're going to tell them, we're going to come here, we're going to sit here in our big chair, and we got to show Mr. Sun, it's going to shine on you. And then we just talk about what school you go to, how do you like these, you said on your share sheet that we have that you like to eat pizza, your favorite book is this, and you like to watch this movie. So we're going to just talk with them and relate to them. Then we're going to tell them, but we have Mr. Mirror here, we're going to look at your teeth, and we got Mr. Tooth Counter, we're going to count your teeth. So that's basically, we're going to say it in terminology where they will understand it and they can relate to it. So it feels like it's not intimidating, that it won't make them afraid.
Well, that sounds great. The kids shouldn't really have any problem because you have prepared the parents. You've prepared the kids with that sharing sheet. You already know what they like and what they don't like.
Yes, we do that with all of our new patients, yes.
And then when they come in, the room is just so nice and cozy. And then you've got the terminology. So it seems to me there's no reason for a kid to be nervous. Well, I thank you for talking with me. I want you to give some encouragement to parents out there. They're about to take their child to the dentist for the first time. And what can you say to them to help them prepare that child? This is a new
Well, I think number one, you're taking them into a new situation and they're meeting new people that hopefully you can develop a relationship with, and you can have that will be their dental home for years to come. Number one, be positive. Be positive. That's number one. Number one, be positive, because you're going to meet the dental assistant is just equally as important as the dentist, because they're going to be doing a lot of different things as well. So you get a chance to know that dental assistant, and then you get to know that you'll have an opportunity to meet the dentist and to get also to know that person, as well as the dentist getting to know you. So you are forming a relationship with that individual. And the next thing is what you can explain to your child is that we're going different things. You're going to have to open your mouth. They're going to be looking at your teeth, but what they're going to be doing, they're not going to hurt you. I'm going to be there with you, and nothing that they're going to do is going to hurt you.
So keep emphasizing that they're not.
It emphasize the positive.
Well, it sounds to me, Dr. Smith, it's like the two things: preparation and positivity is really what's going to help you pediatric dentists when a child is going to the pediatric dentist. They're prepared.
Yes.
Because you've also prepared the parents and you've prepared the child.
Yes.
The sharing sheet. And then you've used you've done it in a positive way. So that's great. Very good. So don't be afraid of the dentist.
That's the bottom line. Yes.
Thank you, Dr. Smith. Thank you, ladies and gentlemen, for joining me in my chat with Dr. Smith. She's a very experienced pediatric dentist in Chicago, Illinois. And I thank you so much for joining me today. Well, I hope you help a lot of children for many years to come. Thank you, Dr. Smith.
All right. Thanks for having me.
Ladies and gentlemen, I'm Linda Mitchell, and now you have a chance to hear from an orthodontist, Miss Lauren Hood-Olson. So you've heard from one dentist, now you're going to hear from an orthodontist.
I am an orthodontist, and I practice in O'Fallon, Illinois, which isn't too far from St. Louis, Missouri, so kind of across the river there from St. Louis. I have been practicing since 2008 and opened my own practice, bought an existing practice and made it my own practice in 2013. So have been on my own as a sole doctor since 2000.
Okay. Now, for our audience, please explain the difference between an orthodontist and a dentist.
We all start off as dentists, general dentists. That's what we get our doctorate in, is general dentistry. After general dentistry, you can choose to specialize, and there are several specialties in dentistry. So an orthodontist is a specialist. So I went to a residency program. Residencies are usually around 3 years. Just does specifically braces, aligners, so tooth movement. But I also specialize in not only just, making teeth straight, but jaw abnormalities, making sure that the upper and lower jaws fit together. I work with oral surgeons for patients that could potentially need surgery for cases. So an orthodontist just really deals with malocclusion.
Now, I know your practice, you deal with a lot of children.
Yes.
Because is it usually the younger population that's getting braces? But I've seen adults with braces too.
Absolutely. I mean, the adult population has been just growing and growing every year. I mean, since, like I said, 2013, when I had my own practice, I mean, my adult population probably grows by about, 5% each year. But for the most part, I would say it's kind of a 70-30 split, maybe 7% being children under the age of 18. So we start evaluating children anytime after 7. So at 7 years old, we usually try to get parents knowledgeable about bringing their children in for a consultation. Most of the time, the consultation is simply me just taking a look at how their primary teeth are coming out and their adult teeth are coming in. We might take a panoramic x-ray to check on the eruption, make sure there's no missing teeth, extra teeth, anything like that that could be seen at that age. And then I'll most likely follow those kids from about 7 to 11. The average age for children in braces is anywhere from 11 to 13. Now we'll have some kids that lose their teeth a little bit later, and they may be more of that 13, 14 age range when they start orthodontics. And then most of the time, an orthodontic treatment on average is about an 18-month treatment to do most things we can accomplish in about 18 to 24 months. Okay. But like I said, with aligners, clear aligners, like, trade name Invisalign, clear brackets, and things like that have really started to become mainstream.
Yeah.
The population does increase because I have a lot of parents that may have had treatment when they were younger and didn't wear a retainer, or their family couldn't afford orthodontics when they were a child. So now, as an adult, they're getting treatment.
Yeah. Well, here's the focus of our conversation, Dr. Lauren. I'm thinking about those kids, those young kids. You said 7 years old, and they're just so nervous about coming to see the orthodontist. And how do you deal with that? How do you calm a child that's just absolutely, I don't want to go, they're kicking and screaming? Tell us about that.
Sure. So we do a lot of how I would probably say is modeling. So even in my own family, I have a daughter who's 10 and a son who's 8. And when it was time for them to start seeing the dentist, I mean, I can look in there. I could clean their teeth if I wanted to or whatever, but I really wanted them to establish a relationship with a dentist that was not myself. I found for my son, who was definitely a lot more hesitant about, having his teeth looked at or getting his teeth cleaned, that it really helped him to see his sister. So he would watch his sister get her teeth cleaned or whatever, they were doing. And so I found that modeling worked really well. So in my practice, a way that we try to model things is because orthodontics is something really new for most kids.
Yeah.
Know what the appliances look like. They don't know what the pieces are. They don't know how things are going to feel. So what we do is I have several social media platforms, but one of them is a YouTube channel.
Okay.
And staff and myself have gone and made YouTube videos for kids to get on and they can watch. So when I'm telling them and talking to them about what an impression is going to be, they can watch what an impression is and how an impression is taken. Or if I'm telling them we're going to put in a palatal expander, that sounds like a really scary thing, to an 8-year-old. What are they going to do this? I've got videos about what palatal expanders are. How do we fit them? They watch me glue one in on a child. They watch one being turned.
Oh.
I try, and I always have the parents, when they come in to meet me and see me and I give them the treatment plan, encourage them to go on and watch those videos. Because it takes a lot of the scare away once that they can see it. And, and I always tell them, I'm like, you can go Google putting braces on. You can Google palatal expanders. I said, but there's so many ways to do it. You get to watch me doing it so that when you come to my office, this is what it's going to be.
Oh, that gives them a certain comfort level.
Absolutely. Yep. And then while they're in the chair, I mean, obviously we still have the ones that, get anxious. My staff and then myself were really good about just kind of talking them through every single step. And I always ask, I said, do you want me to tell you what I'm doing? Or do you just kind of want me to be quiet and do it? Because some people, too much information can scare them.
Yeah.
But most people or most kids, honestly, most kids want you to talk to them and be like, this is a ring that's going to go on your tooth. We're going to slide it on your tooth. This is the glue we're going to use.
Okay.
It might look like it's a needle, but it's just glue, and I'll squirt some glue out on my hand. So I just kind of show them each step that we do, and they do very well. And then once they've been in the chair a couple times with orthodontics, since they have to come see me so frequently, they really kind of calm down. I don't think I've really had a child that from beginning to end was overly scared about things. It's maybe that first couple appointments.
Right.
Kind of like, okay, Dr. Lauren.
Do you give them a little treat?
So
sticker or something?
Yeah, we try to with our office work on a points system. So they have different ways they can earn points. Obviously, one, their teeth clean and healthy. And every 5 points they earn prizes. So I've got carabiner clips, backpacks, hats, blankets, t-shirts.
Wow, that's awesome.
So the kids really get into earning those points and they ask about it. They're like, Dr. Lauren, did I get my points today? So
I've never heard of that. That's great, Dr. Lauren. Yeah. Well, one more thing. What tips do you have for parents at home? How do they talk to their children when they know they've got to go to the orthodontist and get some work?
Sure, absolutely. So I really just tell parents to, as much as, because some parents have been through orthodontics, some have not, but some that have been through orthodontics, just to talk to them and tell them what they're going to expect, especially for the first consultation. The first time I ever meet any patient, it is they're going to sit in a chair. They're probably going to get an x-ray taken, and then I'm going to take a quick look at their teeth. So, if a parent can really just kind of prepare the child, like this is going to be, you're just going to meet Dr. Lauren, you're going to talk to her, you're going to get an x-ray, and you can, again, Google's great. You can x-ray, panoramic x-ray, and show the child kind of what it's going to look like. But I just feel like talking them through and trying to take any of the what ifs out of the equation really help. And again, with my kids that come in, I always tell them first thing, we're not going to do anything difficult today, anything scary. Let me tell you what's going to happen, and then we'll walk you through each appointment that you're going to come to, because I never want them to feel like she's going to do something when I'm not looking,
Well, I think the main fear that they have is that it's going to hurt, that they're going to be hurt.
Yeah. And with orthodontics, we do describe to them what hurt can be. When we're doing like putting braces on or putting an appliance in, there's nothing that's painful about that part of it. I honestly, I don't even have a needle in my office. So I always let them know that there is no needles in this office.
Oh, that's comforting.
Yeah,
for a little kid, for a little kid. Yeah.
So I'm like, everything we're going to do is on the outside of your teeth. But when it comes to orthodontic soreness and pain, yes, as your teeth are moving, they are going to ache and they are going to hurt. And a lot of kids, they do some type of extracurricular activity, like a sports or dancing or something. And I say, have you ever had a really big workout one day, or you danced for a long time, and then you woke up that next morning and your muscles were sore?
Okay.
But, that day or two went by and everything started to feel good again. I said, that's exactly what orthodontics is. When you come to see me, it's going to feel tight and it's going to feel sore and achy for probably a day or two after. But that's away. And then when, it's not going to be like it's painful all the time.
Okay, well, great. Well, I certainly appreciate your time and you giving the audience, our listeners, parents tips and letting us know that kids don't have to be scared. No. And the way your practice runs, how you talk to the children, that is just so great.
Yeah, thank you very much.
Thank you so much for your time. Ladies and gentlemen, you just heard from Dr. Lauren, as she wants us to call her. She's an orthodontist, and she explained how to keep a child who's nervous, how to keep that child calm. So thank you so much for joining me. I really appreciate it.
Thank you very much. I appreciate being here. Have a great day.
Okay.